Bupa in Australia and New Zealand posted a pre-tax profit of $585 million, while at the same time, 60% of its facilities are failing basic standards and 30% are putting the health and safety of its elderly at serious risk.
Not okay.
Can the panelists justify the profiteering of these companies on the backs and lives of our vulnerable elderly population, and explain why it is that they are best placed to care for our elderly?
Richard Colbeck, that's linked to the question earlier too about the accreditation. I mean, why is profiteering too strong a word? And is it simply that we've got ourselves into a situation where some of these providers, and Bupa is one of them, are too big to fail? How do we deal with that and enforce standards?
Look, I don't put Bupa in the classification of too big to fail. I put them in the classification of big enough to conform, and that's what I expect that they should do.
But they're not doing it. They've got 72 homes and 45 have failed to meet health and safety standards.
And that's why my department is meeting with their management weekly. That's why we've required them to employ additional staff and particular management nurse managers in their facilities, each of the facilities that are not conforming, and in their main office, to bring them back to conformance. I expect that an organisation such as Bupa should be complying with the regulations. That's their role. So rather than being too big to fail, big enough to comply and to conform. And that's what I expect that they should be doing. And that's why in a couple of circumstances where they've lost accreditation, they've actually had to provide services without getting any Commonwealth money. So the Commonwealth fees get taken out when they lose their accreditation. I expect them to come back to compliance. That's their responsibility. And there's no question about that. That is what we expect of providers in the system. And as I said earlier, if they're not going to comply, we don't want to see them in the system, if they're not going to provide a service that's adequate.
Sarah, let me ask you about your experience with your father, because you made complaints. What was your sense of how those complaints were treated and how the regulators responded to you when you went further?
The regulator was useless, completely useless. The regulator, I found it through Freedom of Information documents that I got, that the regulator decided on my first phone call that Dad's case was suitable for early resolution, before they'd even done an investigation, before they'd even gone to the provider. I get the sense that the regulator is very interested in having statistics like, oh, so many cases are resolved within 30 days, as though that means everything's been robustly investigated, wrapped up, and everyone's happy. That's not the case. So I had an appalling experience with the regulator. And on the issue of accreditation, can I just say, Dad's facility passed all 44 standards of accreditation in both of the last reviews. So the entire time he's lived there and lived through these horrors, the facility has been fully accredited to the absolute maximum standard, which to me is just outrageous.
And most people don't know your story, but just give us a small sample of the horrors.
Well, I think the very worst thing for me was a whistleblower came forward. Dad's had a number of horrors there, medication mismanagement, all sorts of stuff, but a whistleblower came forward and told us that someone had been deliberately victimising and abusing Dad, let an infection get so bad that he had to be hospitalised, verbally abused him, told him that she was sick of his shit, left him in soiled incontinence pads for hours with the door closed. It was a horror show, and that was the substance of my complaint to the then Aged Care Complaints Commissioner. And that was suitable for early resolution on the first phone call.
Julie, I'll come to you in a moment, but Sean Rooney, isn't the reality that that complaint and that person who was known to have behaved like that could, if they were fired, and we don't even know if they were, could then get a job in another institution and there'd be no record of them?
Yeah. That's right. You're right, Fran, and this is one of the shortcomes in the system, is that there is...
Shortcoming?
There is
is that what we call that?
Well, there is not a national database, which we've advocated for and fully support, for personal care workers, so we can actually track their accreditation, their qualification, and also their work history. Because at the moment, if you're employing somebody into the sector, you're relying on all the usual police checks and referees. But if you don't have that, I guess, professionalisation of the sector, then we can't be assured that these people aren't actually moving to other locations. And that's why it's fundamentally important to get that right.
We keep hearing what's fundamentally important to get right. We know what they are. We've allegedly got the reforms in place, but we keep hearing these stories, Julie.
And the stories are not acceptable. I mean, it comes back to the point that Sarah made earlier about transparency of funding and where does it go. I think that if we're going to talk about future funding of the aged care system, if we're going to talk about what is quality aged care and how we're going to pay for it, we have to have transparency on where the money goes. If it's taxpayer money, we need more transparency. But we also need transparency around the complaint system. And I said on the very first day, when the legislation came through about combining the Safety Commissioner and the regulator, that I wasn't convinced that the new Safety Commissioner has enough powers to intervene and arbitrate early. And I think that the Commissioner needs more powers to intervene and arbitrate much earlier in any of the complaints that it is receiving. I mean, if your complaint at the very first phone call was requires early investigation and decision, then why didn't that happen?
Okay.
That is my question. It should be able to happen and they should be able to arbitrate and make a decision and rectify it quickly. The other thing is for repeat offenders that continually breach accreditation, I think we need to consider some form of penalty.
Criminal penalty?
I think we need to consider some sort of penalty.